Welcome back to the Grow RDH podcast. My name is Katie and I'm a dental hygienist from South Dakota. Today on the podcast, we are continuing the Enneagram series. And tonight we have a really fun and exciting guest. This is Bryce Taylor. He is a dental hygienist in Omaha and he works at Premier Dental. And he was originally one of my students. So I'm super excited to chat with him tonight. He also, we had one of our Enneagrams also graduate in 2020. And so same thing for Bryce. He graduated in like the worst time to be a
Oh
dental
yeah.
hygienist. What a time, right? But we made it through. So first though, I'm just going to give a little brief overview of an Enneagram 7 and some of the traits and characteristics that they typically see. Sevens are energetic, spontaneous, and always looking for the next exciting experience. They're known for their optimism and adaptability, and they love adventure. They often bring a really contagious sense of fun to any environment they're in, especially a dental office. At their core, sevens really crave freedom, so sometimes the restrictive and structured environment of dental hygiene can be difficult to manage, but in the positive light, this makes them great problem solvers and morale boosters in the workplace. However, sometimes their tendency to chase new experiences can sometimes make follow through a challenge. So they might struggle with boredom and a sense of feeling trapped in routine. In dentistry, sevens are the ones you can find making everybody laugh, finding creative ways to engage with patients, and are constantly looking for new opportunities. So tonight, again, we have Bryce with us. Bryce, tell us a little bit about yourself and how you experience dental hygiene as a seven.
Yeah. Hi, I'm Bryce. I'm from Elk Point, South Dakota. I actually grew up in Jefferson next door, but all tiny towns. I a first generation student, which was kind of fun to be able to kind of dig through that experience without anybody else showing me the way. But I knew I wanted to be a dental hygienist from high school. I did a little bit of shadowing with a nurse practitioner, and I was like, whoa, that's a lot going on. So I always say now, like, I'm above the shoulders, except for an oral cancer screening. But dental hygiene, I knew from high school. I jumped right into it. And everybody said, well, what if you don't get into hygiene school? I said, I will, and I'm going to do it because that is the route for me. So, so here we are, 5 years into clinical practice, and I love it. I love my patients. I served tables all through high school and college, and to me, dental hygiene is serving tables, but with so much more science behind it. But at the end of the day, I feel like that foundation is the exact same thing that I do every single day. Instead of seeing people once a week, I see them every 3 months or every 6 months, and those have become my network in this city. So I love it. I love my job. I love my career. So grateful for it.
I love that. That's so fun. Thank you for sharing that. We're going to get right into the questions then. And these questions are all just about how that Enneagram 7 fun loving, adventurous personality type kind of shows up in your work. So the first question is sevens are known for their energy and enthusiasm. How does that show up in your work as a hygienist overall?
Yeah, absolutely. I feel like energy is not an option. Like you have to have it for hygiene. That is just like that fast pace all day long. I mean, you're on stage physically, emotionally, mentally, all of it. That's like never even been a question for me. The coffee helps, but it's not necessary. But the enthusiasm, yeah, you have, like I said, you're on stage. I have to put in all of that to my patients. And when you see that good review on the back end, or when they say, "Can I stay with you? Can I see you next time?" Like that is like that's what all of that is so much for. It's the core of everything in dental hygiene. I feel like, yeah, we can all scale the teeth. We should be able to, right? But if you can't get that patient back in your chair, then what are you doing at the end of the day?
Yeah. How about with your coworkers?
Yeah.
Again, knowing you as a person, your enthusiasm just, I mean, comes out of you. Tell me what strengths you bring to a team, like your coworkers, your hygienists, assistants, doctors.
Oh yeah, so there's 8 of us hygienists in the practice. There's 8 doctors. Each doctor has 2 assistants. So there's over 50 of us in this office every single day. It's a lot going on, and I love it. So many different personalities bouncing around. But I feel like my hygiene team specifically, we're so much on the same page that some days we don't even see each other, but we're still connected in every moment like that. It's funny because we have little walkie-talkies that we wear with that many people. Like some days I won't see people at all, but I'll still have a conversation with them. In that little thing, like the enthusiasm means so much more than an assistant who's having a bad day and throws a little attitude on the walkie, like if I'm not interested in it, then I'm not giving that out to my colleagues. And with the assistants, they're my favorite people. They're the workhorses of that office, and every moment that we get to pass by each other in between patients in the hallway, like you know me, I always have something to say, or I always have a look on my face, or we're gonna do something weird, a little dinosaur noise or something. Like that's what fuels me to get through the day, is those interactions with my colleagues. And when the doctors come in to do, exams, yeah, we're talking jargon. We're doing the science of it all. But also, I will take every single opportunity to pull the patient into a conversation that has nothing to do with dentistry and is going to be, I don't know, sometimes quirky and weird. And I'm going to make the patient laugh, or I'm going to make them go, "What did he just ask me?" But those are good.
Those are good. I just, yeah, just knowing what joy you have for life in general. I can't imagine anyone having a bad day if they work with you. I just can't.
Yeah. We try not to do that. Nobody has time for bad days.
No. Okay. Second question. Routines can sometimes feel restrictive for sevens. How do you keep things fresh and exciting in a job that does have a lot of structure?
Yeah, I feel like I live right on the middle of this, and depends on the day. Because I need structure to function. My office, my team, like we function very much off of the same policy and procedure. It's laid out for us. So I need it. But the restriction of it is, yeah, sometimes, I'm going to meet a patient where they're at. And if somebody isn't the type of person that's going to tolerate sitting there and looking at a PowerPoint about silver fillings, then I'm not doing that, like whether the boss wants it to happen, right? Because that's policy and procedure. But I feel like those constraints are for me where it's like, I have to switch it up in order for this to go as organically as possible, So I feel like that's really where it is. It's me and the patient back and forth. The structure for me, I need that to function to get through the day. I'm so routine based, even when I get home, it's the same thing. Shoes off, and then we're going to take a shower, and then we're going to dry the hair, and then we're going to make dinner.
Yeah.
Ridiculous.
Yeah. No, that's great though. It sounds like you found a lot of ways to like bring that like creativity and authenticity into like patient education and stuff like that. That's awesome. Sevens tend to avoid discomfort or negativity. How do you handle those days that are just really tough? You maybe have difficult patients or some workplace conflicts. How do you kind of mediate?
Yeah, everybody that knows me personally knows that confrontation is not something that I want to have. If we can just figure this out and move right past it, no matter what it is, like that's definitely what I want to do at the end of the day. So if it's like a patient interaction, sometimes I'll have people come in for, let's say, a new patient exam. And I mean, we're taking photos and x-rays, like we're in the nitty-gritty of it, comprehensive for a reason. And I'll get pushback, especially sometimes people who were maybe in the dental profession at one point in their life, and then raise kids, and now it's 40 years down the road. So things like, I had a patient specifically one time who said, "No, we're not going to take those x-rays. You're just going to go ahead and clean my teeth." Those are the moments when it's like, whoa, I didn't invite this confrontation. Sorry you feel that way. We have a standard of care. Demand myself to follow that for you and for me. If this isn't the right fit for you, that's fine. I hope you can find that. And that's how I have to handle a confrontation like that. Obviously, because I'm representing an office, that's the professional situation. A colleague who has confrontation, usually I'm going to stand up for myself, and then I'm going to circle back later after I've filtered out the emotion of it and say, all right, let's have a conversation. Let's be level-headed about this. And I can tell you I've never had a relationship in my office of over 50 people that has not been resolved or has not found a new hurdle, like I don't have time for that.
Yeah. Yeah, I love that. So you're about 5 years out of school. Do you feel like, I mean, it sounds like you've been able to develop some really good assertiveness and good skills in that. Do you feel like that is something you had right away when you graduated? Or like with your work, maybe you said you were a server or waiting
Yeah.
tables. Do you feel like that's something you've naturally sort of developed over time with your work experiences? Or is that something you kind of like really had to learn in dentistry?
I think again somewhere in between, yeah, serving set me up for that. I feel like also being the youngest of six kids set me up for that, You had to be, and the second of a twin, if I'll add that, you had to be assertive. You had to show up and let people know you were there. So both of those things I feel like gave me some start to it, but going into dental hygiene school specifically was like a huge jump for me from small town to a program at a university, So I feel like I felt like I drew back a little bit just because it was new murky waters.
Yeah.
Not murky,
Yeah.
but new waters.
You. Yeah.
And so I feel like a lot more of it was built up through hygiene school specifically. A lot of strong personalities, guiding you and lifting you up. And you automatically take some of that on, especially because it's so personal sometimes. But yeah, I feel like now, my friends would say that, like, if you want an opinion, Bryce has one. If you want somebody to stand up for you, Bryce will do it. If Bryce needs to stand up for himself, he's doing it.
Yeah, I love that. I also served, I mean, I started when I was 14 and I did all through college. And that is just over time. I recommend it to everybody. That is like the
Yes,
best. It's the best professional development, like even before you know what professional development is, because any
100%.
customer service job, there are always mad customers, right? And so you just learn that over time, and it's such an amazing experience no matter what profession you choose. Like waitressing is not easy.
I think, yeah, it's foundation that everybody should have. I agree with that. If you're going to be working with people, and even if you're not, go serve for at least 6 months. Learn what that's like. And
Yep.
especially because it's also something where you're getting paid this tiny wage and relying on the service, relying on the experience. And
Yeah,
so
you
that's
need
like,
those tips.
yes, absolutely.
Even bartending, I mean, you deal with a lot of people that obviously are intoxicated and they're not in their right. So they're a little more aggressive, a little more. And so, yeah, the last couple years of college, I bartended, and same thing. It's just so good at, you're good at conflict management,
Yes.
mediation. I can talk a drunk guy down so quick.
Oh, yeah, absolutely.
Sometimes it's just like distraction, and then like
Yeah.
squirrel, never mind.
Moving on. Yep. Especially a man.
I like that you brought up birth order too. I am an oldest child, and I only have one sibling. But there is so I find birth orders so interesting. So you are a youngest child of six.
Yes, yes. So there
How
were
do you
three girls and then three boys. And the youngest two were twins, but still my brother 8 minutes prior to me. So the baby of the baby.
literally, yeah, as much of a youngest child as you can get.
Absolutely.
So this is a little bit off topic, but I'm interested. How do you think that's impacted being a youngest child? It's make it made you more assertive, you've said.
Yeah.
How has that impacted your ability to maybe connect with patients?
Yeah, absolutely. I find myself talking about my family and where I come from a lot with patients. Obviously, I'm not that far from home. I'm only an hour and a half south. So they have an idea typically of what it was like at home. But yeah, I feel like especially, I will admit it, pedo is not my specialty. I have a
Mine either.
much better time laying it straight to adults. But I feel like kids are the moment when I really have to go back to that kid myself or being a sibling and understanding, you can instantly ask them, how many siblings do you have? And you're how old? Okay, so I see you're right in the middle of them.
No.
There's a lot going on, isn't there? Yeah, exactly. And kids are like that extra barrier you have to break through for them to be able to even talk to you, to trust you,
Yeah. I am the same way. I would not do well in a pediatric office. I just wouldn't. I connect really well with inmates.
Yeah.
I mean, started at the prison in 2012, and I have said since 2012, I don't even think I could go back to private practice.
Yeah.
Just because even just seeing kids, it's just a different. And I even say this with my children. Like I have two 6-year-old twins and then a 9-year-old son. And even like the older they get, like I was not meant to be a toddler mom, but give me that
Yeah.
9, 10-year-old. And like Harvey's like having conversations with me now and like
Yes.
and I'm just like, this is
Hmm.
awesome.
Yeah.
So it's some people, I just think it's different personalities, and some people just aren't cut out for the little ones. And that's me.
Not me.
All right. We'll keep going. Next question is, a lot of the times sevens are always looking for like the next opportunity, whether that be in your professional career or maybe hobbies or something like that. How have you found ways to bring variety to your life in any way?
Yeah, absolutely. That's so interesting to see how things actually pull out. There's something to this, obviously.
Yeah.
But I am always the one to say, and I feel like I recognize this early among people. I feel like I'm pretty analytical when I'm in a large audience, But like, I really noticed from an early age that people who stop having something to look forward to, say a grandparent or or just somebody older without children, whatever the situation is, you see people so frequently who have come to a point where they don't have that next goal to reach to other than just like living it out. And that taught me right away that you have to have a next goal, if it's big or small, to move forward to. So, I've been in the same scenario for 5 years now as an adult, practicing, making friends on my own, living on my own, all of these things. So it was a huge switch up. And now I feel like 5 years in, I'm at the point where I'm saying, okay, what's that next goal that I need to be reaching for? Yes, professionally, growth is always happening. I feel like in dental hygiene, you can't not grow to some
Right.
degree.
Right.
So professionally, yeah, I'm always looking for that next goal. But personally too, I feel like is the stronger part for me where I'm at. What's next for me, and my life is gonna look so different than so many. I already know this. I told my parents, don't expect me just to buy a house with a white picket fence and have kids. First of all, I want a condo and there's gonna be nobody else in it, Not even a goldfish. So yeah.
So one hobby when I think of you, I mainly see you on social media.
Yeah.
Can we talk about fashion? I feel like
Yeah, please.
I feel like fashion is your hobby, maybe?
Yeah, I do love it. I love it. And there's something about it I'm sitting in my room right now and like there's ridiculous amount of clothes surrounding me. It's preposterous. A white fur, anybody? For what reason? I feel like I have, like I said, I think I'm a control freak sometimes, and being able to put on whatever I want and feel good for me, for what I see in the mirror, and then to go out with my friends and have a glass of wine or have dinner, like, is the most empowering thing for me. You might not see me when I'm in my scrubs and my hair is tied back and I've got my loops on, but you will see me out here, like I love it. I love it. And anytime I'm shopping, my friends like, you want to go to the mall? And I'm like, well, I'll go to the mall, but they're not going to have anything there that I want because everybody else is wearing it.
Yeah. So
That's what I
you
think
have
that's
higher end taste?
I don't have to go expensive and I don't need a label, but I want it's going to emulate that, not because of the brand, but because that's what you see on the runway. And the runway is making choices that are original, they're not
Yeah.
copied.
Yeah. So even like thrifting or finding.
Yeah, love it. Love it. If I can find something and something weird, that like I'm going to go into the grandma section and look at the elastic waist pants and you're going to find something so cool in there that nobody would normally say like, let's give this to a 6-foot man. I'm like, let's go.
Yeah. Yeah. I just remember I just remember when you were in school, it was always the shoes. You always
Yes.
had the flashiest, best looking shoes out of the whole
Yes,
class. It was
absolutely.
it's so fun, and it's fun to watch and see the outfits you post on social media too. So I don't know.
Yeah.
I'm admiring from afar. Just know every time you post a picture, I'm like, oh.
I love it.
And I think it's a little bit of like jealousy too, because I'm the least fashiony person. And I wish I had more of like an eye for it. But I'm just like,
Totally.
when I see people that can do it, and maybe it's your creativity and your Enneagram 7 type of like just being
Yeah.
creative and
Yeah.
adventurous with your style.
Yes. Yep.
And then there's me, and I'm just like, black scrubs, call it good.
We're good. Let's go.
Yeah. Yeah.
I always get the comments at work too, I have the shoes that are the same exact navy blue color, and the socks are white. Like so much about that and I always get comments on the shoes. Wow, what a perfect match. I'm like, I know.
That's
I did
intentional.
that. Yeah, exactly. Because if I had the wrong navy on, my colleague Jasmine, and I tell her too, I said, your navy doesn't match, but that's okay. You look good, girl.
Oh my goodness. See, that's awesome. See, you're helping them out in multifaceted ways, right?
Listen, it's a conversation starter every single time, fashion, and that's what I'm here for. Let's have a conversation about something, you know? Let's
Yeah.
talk.
Yeah. So let's circle back then to professional goals. What are some big goals or dreams you have for your career? And if you're not sure, that's totally fine too. But how does your adventurous nature, your enthusiasm play a role in them?
Yeah, absolutely. What is next for me? Definitely I guess I shouldn't say definitely. I don't know that for sure. I feel like long-term goal for me, education is the route that I'll end up in because of that natural leadership. Because I think learning is fun. I'm a nerd as an adult. I'm like, let's learn about history. Let's read about conflict. Let's read something in a science journal just for fun. So I feel like having that just naturally tells me that I'm gonna head towards that direction. Now, I don't know what that looks like if it's like clinical or if I go back to school myself and can have a higher role in education. So I think that's where it's going to lead me eventually. I think next step though, I don't know. I feel like I would like to work in maybe a specialty role in hygiene, or maybe expanding into like myology, I think is kind of cool. So shifting a little bit, I find orthodontics to be cool. So I don't know, there's just I feel like there's roles that don't exist that should exist.
Yeah.
There's gaps there and those specialties I feel like should be sought out. I don't know. That's what I'm feeling next is what is in my city that exists or could exist that I can fill into, using my education that I have, but also using my other skills way more than I ever have.
Yeah. Speaking of that, and I don't know why I just thought of this, this isn't even on my list of questions, but speaking of that, your state to the south is Botox. Have you heard anything in Nebraska as talks as far as following Kansas and maybe looking at Botox in Nebraska?
Yeah, um I would love to do it, first of all. I think it's cool. I think it's fun. We have a doctor who did the training on it. I was the guinea pig, so I've been in the experience a little bit. I don't know that I see Nebraska shifting to that anytime soon. I'm in Omaha, so there's a lot of younger practices that deviate from, I don't want to say old school, but
You
old
can, you can,
school,
you can say it.
old school,
Yeah,
especially because we're surrounded by rural areas. So overall, I don't know if I see Nebraska shifting anytime soon. I feel like they like to be a South Dakota, Iowa conglomerate. You know what I mean? But yeah, I think it's great. I love to see any expansion of dental hygiene roles because we worked so hard to get here and have so much experience and so much intimacy that aren't we the perfect people to fill those voids and to create those roles and
I
expand
agree.
those roles, not legislate us out? But
Right, right.
here we are.
But and you're from South Dakota, and you know how we can say how slow South Dakota is to move on anything. I mean, it's
Right.
just, and so Nebraska tends to teeter towards more South Dakota speed.
Yeah.
But I
Yeah.
just was like, wow, like it's so close. Kansas is right there.
Come on.
Come on.
And I think there's so much potential too. There's a lot of people in Omaha. There's a lot of change and progressiveness overall, growth. That's the core of that. There's a lot of that happening in the city. So obviously we're not just the city. That's not just Nebraska. There's so much west of us, but I feel like at the end of the day, we're gonna we have to balance out and move into. Expansion will happen at some point, but I don't see it anytime soon. but it would be great to see.
Yeah. All right, last and final question. Just wrapping it up with any words of wisdom. So, what advice would you give to other hygienists, especially those who might feel some of that rigidity and structure, on how to bring more joy and excitement into their work?
Yeah, I love that. My colleagues are always the one who say I'm gonna say something weird and make them laugh. Every time there's somebody new in the office, I feel like one of the first couple of things I say to them after getting to know them is, it's kind of tough here. There's a lot going on. There's a lot of policy and procedure. There's a lot of standard to meet, but we're going to make it super fun and it's going to be a great time. And every single day there's new energy coming in and we're all in it to win it together. I feel like I love my job so much. I love dental hygiene, the world of dentistry, the personal interactions you get in that is like the most important thing for me and the thing that I've loved the most. Building a network of people and, my one of my patients is my hairstylist. One of my patients is my massage therapist. One of them's my eye doctor. Like it's such a cool world that you just don't experience any other way, I feel like. So anybody coming into that world, you know, it's a great experience. You're gonna meet a lot of different people, and your personal growth too is gonna be like more tested than you've ever thought. Like I know I've grown so much in 5 years. I would look back at myself in hygiene school and say that guy didn't even know half of what he knows now, and part of that's the education itself, and then everything else that comes in the world of dental hygiene specifically. I feel like.
Yeah. Yeah. And it's a unique opportunity. And every single patient's different, right? And so they're going to bring different energy, and you can kind of choose to like absorb that energy, or you can choose to like keep your own energy and just give it back, right? And so
Absolutely.
I love that. Thank you so much. So I appreciate your time. Everybody, thank you so much for listening. If you have any questions, comments, or for the sevens out there, if you agree with what he's saying or have experienced some of those things, definitely put it out in the comments. We would love to hear from you. We will continue our Enneagram series with Enneagram 8 and with Kaylin. And you know Kaylin, right? Kaylin.
Yeah, I love Kaylin. That girl's the best.
So she's my Enneagram 8. And so we will be featuring her on the episode for next week. So if you like this content and you value it, please like, share, subscribe, and I will see you on the next one.